Okay, thank you for that, Mike. Well, we've got another short interview clip with a former nurse called Debbie Evans. She was talking to me over the weekend about the dangers of swabs, and well, I really paid attention to what she was saying. Let's hear what she said and what her precise warning
Sorry,
was.
but these swabs are with respect up the nose swabs with respect to testing?
These are to do with the throat, but particularly the nasal swabs in relation to COVID-19. You were warning quite some time ago that there were concerns around the use of these deep nasal swabs for the COVID tests. For people who've got no medical experience at all, tell us a bit about what's actually going on and why you've got those concerns.
Well, I've had, as you know, Brian, I've had the concerns right from the get-go, really. I'm a trained state registered nurse. I trained back in the old days in the 70s, and I specialised in ear, nose and throat, both on a clinical setting and within a theatre setting as well. So I know what nasopharyngeal swabs are, and I know how potentially dangerous they can be. And even as an ENT trained nurse, I would not feel comfortable without specific training, supervised by an ENT surgeon or an ENT consultant. I wouldn't feel safe in performing a nasopharyngeal swab. And the reason is because it's very invasive. And I don't know why we're using six-inch swabs that go right at the back of the throat and right inside the nasal cavity, especially in healthy people when we don't need to. And I think what's important to note about the anatomy and the physiology of the head is that each nose is different, as we know by looking at people, and noses have different ridges and bumps inside them. So no body is the same. You know, everyone is unique. And at the top of your palate is something called the cribriform plate. It's very, very delicate. It's a midline bone, and it's really important both to the skull and, well, other people know the skull as the cranium, and the nose. And what it does is it's a bit like a mesh. It's not like a long bone like you think, you know, the femur would be. It's like a mesh bone. So the olfactory nerves pass right through this. It's really delicate, really, really fragile. And if you damage it, it can be extremely serious because it's really, I guess, putting it in layman's terms, it's the gateway to the brain. It's the partition that kind of closes your brain off to the rest of your head. So it's really, really delicate. And these swabs are very long. And I've spoken to people that have had swabs stuck down the back of their throats, and then the same swab has been stuck up their noses and turned around, twisted, and held there for 15 seconds. Now, what I'm struggling with is why we need to use these invasive tests, because there are actually papers that have been published to say that saliva is more sensitive for SARS-CoV-2 in COVID-19 patients than nasopharyngeal swabs. And that was a paper that was published back in April 2020 by Anna Wiley et al. So my question is why are we needing to use these swabs, and what could be on the swabs? What are we introducing into the body when we don't actually need to?
So very clear piece there from Debbie Evans, and of course 2 points: the dangers of the swabs, of taking the swab with these long probes up your nose, dangerous, and then she's pointing out we could do this very simply by taking a sample of saliva and do a better job. So let me just reinforce what she said, because there is material available. This is the JAMA network reporting the case of a 40-year-old woman. I'll come on to that in a minute. But in this article, there's this diagram. The little yellow arrows you can see in each of the 3 images is pointing at the area that Debbie is talking about, and certainly with the section on the right of your screen, you can see why she's talking about the immense danger of putting something up so close to your brain. Now, this is the report from JAMA Network. It said that a woman in her 40s presented with unilateral rhinorrhea, that's a discharge from the nose, metallic taste, headache, neck stiffness, and photophobia. The patient had recently completed nasal COVID-19 testing for an elective hernia repair. Shortly after, she developed unilateral rhinorrhea, headache, and vomiting. The patient's medical history was notable for idiopathic intracranial hypertension and removal of nasal polyps, small growths, over 20 years before presentation. And it went on to say that physical examination revealed clear rhinorrhea from the right side of a nose, flexible nasopharyngoscopy. That's a difficult word. I'm sorry I made a mess of that one. Revealed a mass in the right anterior middle meatus, but did not identify the source of the fluid. To our knowledge, this is the first report of an iatrogenic CSF, cerebrospinal fluid leak, after a nasal swab for COVID-19. It then went on to say capacity for COVID-19 testing is increasing in the US, with plans to ramp up to as many as 6 million tests per day by the end of 2020. Although it's now routine in the US to rule out COVID-19 prior to elective surgeries, for many hospital admissions and for symptomatic individuals, additional testing may help contain the spread of COVID-19. As the number of daily COVID-19 nasal and nasopharyngeal swab specimen collection procedures increases, a greater burden is placed on the healthcare system to, quote, properly train clinicians and even the general public to safely perform nasal and nasopharyngeal swab testing. And it ends with this: high quality instruction on how to properly obtain an adequate nasopharyngeal specimen for testing is available. However, adverse events may still occur owing to complex and delicate anatomy. Such complications have not been well described in the existing literature. So many people having something pushed up their nose with immense danger, particularly if you have an underlying medical condition affecting that area of your face, your nose, that you're completely unaware of.
That says there such complications have not been well described in the existing literature, but they're very well described, or at least there's an effort to describe in a particular way in the various fact-checking organizations and publications, because this issue has been very much downplayed by those. But again, there is no basis for the downplaying by the fact checkers. Once again, the scientific literature shows that this is a much more complex situation than they imply, and the questions still need to be asked and answered.
Yes, and it takes a retired nurse to come out and start talking about the details of the dangers here. Well.